Well, hi, Rachel, and welcome to Rebuilding My Health. I am excited to have you here today to talk about your health success story.
Thank you. Thank you for having me. I really believe in what you're doing and I love what you're sharing.
Thank you so much. I appreciate that.
Yeah.
Tell us a little bit about you to get started.
I am originally from Wisconsin. I, however, have been living in Hawaii for about 22, 23 years now. And my husband and I will celebrate 17 years of marriage this July. Um, We have a daughter just turned 15 a few weeks ago. So we are in the teenage years. We are teen parents now, or parents of a teen,
Yeah,
um, which is wonderful. Um, I am a massage therapist. And a yoga teacher. I have an incredible practice here, just full of amazing clientele. I've been just wildly blessed with great clientele. I love what I do. And yeah,
fantastic. You love what you do and you're living in a beautiful place. It
yeah,
sounds
yeah,
incredible.
yeah.
Nice. Well, let's talk about your health story. And it would take us back to when you started experiencing some challenges and what that looked like and where it took you.
Okay, so the symptoms um, came on rather strong at one point, but then would sort of become this sort of long, steady road of increasing in severity, and become what I would consider a chronic symptoms. The symptoms included, I think the worst of it all was um, severe fatigue, just debilitating. I started to call it the watching my plants die phase of my life because I was so incapacitated. My plants were just, just feet away from me, and I just couldn't get myself to care for them. And yeah, so I call it the watching my plants die phase of my life, which is terrible. I'm smiling now because I kind of make a little light of it, but it was horrible.
Right.
Um, Migraines. I had migraines, very severe migraines. I'd had a migraine or two, or maybe a handful of them previously to the onset of all of this, but they were very, very rare. And, I'd take a 1 hour nap and it would be gone kind of thing. This was very different. They increased in severity, they increased in frequency. I was having them 3, 4 times a month. The pain, the active migraine would last 24, sometimes even like up to like 36 hours. And I'd need another day to recover from the pain, and Advil, Tylenol, eventually migraine medication. Like nothing was really touching them. It was miserable.
So debilitating.
Very, very debilitating. Um,
And you're in a very physical job with
yeah,
yoga and massage. So
yes.
imagine it was really
And
difficult to
yeah,
live.
and I'm a very active person, and I had a very active daughter, so to go down for 2, 3 days at a
Mhm.
time it was so difficult.
Yeah.
And yeah, and then eventually then the joint pain would start to set in. I had very dark urine for about a year and a half before that started clearing up.
Hmm.
And kidney pain, which took me a while to kind of put that together, the dark urine and the pain in my back, that I kept trying to get body work for it, and
Mhm.
nothing was touching it. And as a body worker, I'm like, come on, I can figure this out, right? And with my brilliant colleagues nothing was touching it, I would eventually realize that that was kidney pain. Um, I thought for a while I was going to have to quit my career because the pain in my hands was so intense that I was icing my hands. I was taking, herbs and soaking my hands and everything. And I started to think, I need to make a career change. How am I going to do this? But I was so brain fogged and fatigued. And it was really scary, but the pain was that bad that I thought I might not be able to do what I love anymore, or at least very, very minimally, which is like, oh my God, how am I going to support my family now?
Right.
Um, but the fatigue was even worse because, I went from seeing 12 to 15 clients in a week down to like 3 or 4, and I'd have to sleep a day after seeing a couple of them. Um, the um, anxiety was also very debilitating. I felt like just normal decisions that we all make in terms of like getting, the grocery list and organizing meals for the week, or maybe my daughter had an argument with or an issue with a teacher, or a trouble with her math homework, or an argument with a friend of hers, or um, just the little things we face in life that really most of us should be able to handle, was like gut wrenching to me and would send me in these spirals. It was just like this chronic state of worry, of fear. Um, then I would start to have, I was just completely emotionally dysregulated. I was just crying all the time. Everything just made me cry. I just could not hold it together for the life of me. I was exhausted on every level. Um,
Did you have anxiety before? Like, had that been kind of a pattern in your life, or that was new?
it was not a pattern. I had depression, what I had called depression years before, but it turned out it was really just my digestion. I was not eating well. I was eating a vegetarian, very high carbohydrate diet, and so we realized um, this is when I first met my dear friend Tracy and my functional medicine gal, Dr. Tracy Potter. And so this was when I was like 30, just had my daughter, and I kind of needed to re-regulate. And so there was a little, what I had called depression, but later would learn it wasn't true, depression in the sense of like a chemical. Well, I mean, I suppose it was chemical, but based on what I was eating and not eating.
Mm.
And yeah, so this was different. This was much different. The anxiety, I hadn't had anxiety. Um, and then with all of this stuff really coming together all at the same time, I think really a true depression set in, where I was like in a dark, dark place. I went from a vibrant, up at 4, CrossFit at 5, home a little after 6, taking care of my family, packing beautiful, colorful lunches with organic, nourishing food, and making beautiful breakfasts, and then off to work and school, and, sending my family, all of us going in our directions, and, active with my daughter. We were always hiking and at the beach, and just all of these things. I went from just such a vibrant life to like negative 1,000. It felt like,
Yeah.
and I say that cautiously because I know other people have faced a lot worse things than I did, but just in terms of my scale of where I was living and where I had somehow landed was
Yeah.
really dramatic. Yeah.
Right. Oh, yeah, absolutely.
Oh,
Yeah.
it was depressing. It was depressing, and I'm just grateful that I was a mom. I really think that if if I wasn't a mom, I mean, the thoughts of ending my life were a real thing, and that's terrifying from somebody who loves life. You
Right.
know, I didn't know who I was. I was so sick.
Yeah, it got that bad. Yeah.
It
Yeah.
did. It got that bad, you know. And here I am, like this meditator and loving life, and it's like, Rachel, you know how to get out of this. You know this isn't real. You know, like get out of this. And I just couldn't. I just couldn't.
Right.
Yeah.
Yeah. Yeah. Yeah. Exactly. Yeah. So what did you, what paths did you go down to try to find answers?
Well, that was kind of interesting. I almost am embarrassed how long it took me till I was in this cycle of, okay, you can snap out of this, Rachel. Like, oh, okay, maybe you just need to eat more greens. You know, maybe maybe you're not meditating enough. Maybe you need to do more yoga. Maybe you need to rest more, you know, or maybe you need to take some probiotics or, you know, I kept trying to like
Mhm.
grab onto these little bits of things. Maybe I need to go get more mental health help, you know, a psychologist, you know, therapist. Maybe I need more of that. Um, and I did that kind of thinking, oh, you know, maybe I feel better today. Maybe we're on the upswing. And then it was like back downhill. And then, you know, so I kind of just did this for a long time. And, you know, looking back, I wish I would have taken a deep dive much sooner. And that deep dive was then with Dr. Tracy Potter. Um, and yeah, I realized like, yeah, we need to really
Yeah.
shine the light on this big time and go as deep as we need to go. And so, yeah, took me to her.
Yeah, yeah. But I think it's natural to especially someone who's kind of in the health field to go, okay, well, maybe I'll try this, because you do
Yeah.
have some knowledge and experience and to go, like let's try this and see if it
Yeah.
helps. And because I did that a lot as well. Like, okay, what supplement do I have in my house? I'm gonna try that for a week. And like,
Yeah.
yeah, yeah. But it is kind of like throwing a lot of spaghetti against the wall, like just to
Yeah.
see what's gonna stick. And
Yeah.
so when you saw Dr. Tracy, what were the next steps? Testing, etc.
Yeah, I think the two most important and revealing things that she went after was she had a hunch that I had reactivated Epstein-Barr, which would explain a lot, primarily the fatigue. Um,
Yeah.
and then the next deep dive would have been the gut test. She does this it's called like the gut zoomer or something like that, and it tells you so much information. I was blown away. The markers that from the specific enzymes that you have or you're low on, the specific probiotics that you're low or need more of, the specific inflammatory markers, the hormone, the effect on your hormones. I mean, it was just incredible. The reactivated Epstein-Barr was kind of a funny one because I went to my doctor to order the test. Tracy had given me, this is what you need to ask for. And my doctor was like, she's like, well, I've heard of Epstein-Barr. She didn't have any idea, bless her heart. And so I had to coach her, like through from Dr. Tracy through me. I had to coach my doctor how to order this test. And, because of the nature of it, she said, well, I can't read it. We have to send it to infectious disease to read it. Well, they read it wrong. And, I brought it to Tracy and she's like, yeah, that's how they all read it. They don't have any understanding of this. Um, and so it was determined, very obvious if you know how to read the test, that I had very high levels of reactivated Epstein-Barr.
Interesting.
Yeah.
Interesting. Yeah. Which is the virus associated with mono.
Yes, that's
And
correct.
then my understanding is that if you've had that at some point in your life, it can become reactivated.
Yeah, like any other virus,
Like
like cold
shingles
sores,
or
herpes, anything in the herpes family, it's in there, it's dormant,
Mhm,
and then stress or any number of triggers can
mhm.
set it off.
That is pretty crazy. And yeah, and so I wonder if the testing, if they like their testing is based on like an active or what is their testing like conventional testing, just like looking for active virus or new virus or something?
Exactly,
Yeah.
exactly. There's tests they look for. Have you had it before and now it's dormant, or is it I should be careful on speaking to that because I don't remember all the details, but it was a panel of like four different things we had to ask for. One of them was like the key of, was it reactivated? Because apparently there's some difference between, oh, you've had it before, so you have some level of the virus that'll always be there, to it's reactivated. And this is the piece I think that the infectious disease department didn't know how to read. They just saw it as, according to our um, reading of these tests, like, you have had it before. And I'm like, well, I know that, thank you. But we're talking about right now. And so
Yeah.
yeah, so there's different pieces. It was like four different vials that they had to take.
Okay, that is yeah, very interesting. And I think it's more common than most people realize because
Yeah,
a lot of people have had it at some point. They may not have even known at the time that it was
yeah,
Epstein-Barr or mono, but antibodies show up. And I've talked to a lot of people who've had reactivation. And, but it isn't something that is spotted or really tested in a
yeah,
conventional medical setting. Yeah. So you were fortunate to
yeah.
find the help in the testing. I'm curious, like, do you feel like, and did Dr. Tracy feel like that was the cause of associated with a lot of your symptoms was the reactivated Epstein-Barr?
It was the first, the thing that we had to tackle first and foremost.
Yeah.
There's such a list of symptoms. But according to Dr. Tracy, she said, your whole body is so burdened, so heavily burdened. She's like, you are very sick. Like, it's no wonder your body can't regulate anything else on, the physical or mental level. She's like, so we need to get after this first and get you stronger so that we can, move further in your healing. So that was like the number one
Mhm.
piece, was get your immune system up, get some antiviral, some, herbal antiviral supplements in you, and yeah, strengthen up your gut, assimilation in your gut. And yeah, that was number one.
Mhm. Yeah, so you were taking herbal antivirals, and some
Yeah,
gut healing stuff.
yeah, yeah.
Were there specific gut things you needed to address, like infections or anything?
Well, that was really interesting too, because we did realize that I was not assimilating fats.
Mm,
They were essentially just going right through me. And fats are so, so important for your nervous system, your brain, hence like the anxiety and panic attacks and depression and brain fog, as well as just tissues of your body. Connective tissue is having such joint pain and inflammation. So that was huge, understanding what my body was and was not digesting. And then there were markers as well for leaky gut. So meaning like, your gut I mean, you've heard this, I'm sure, they're just the integrity of your digestive lining. So your body can't even use all this like amazing, beautiful food that I was eating. Like, oh, what a waste, So
Yeah. Right. Right.
that was
Exactly.
huge. That was huge. Yeah.
Yeah. Yeah. So you were doing some gut healing. And did you need to change your diet or just do the gut healing?
Um, I think initially I was already on a pretty good path in terms of that. Um, but there were a few things I had to really reel in. I was kind of gluten-free. I used to sort of joke like I eat a lot of gluten for a gluten-free person because I like to think I was gluten-free, but I would slip, often. And it's not like I had celiac or an overt sensitivity to it. So I felt like, oh, if I ate a little bit of it, that, I didn't have like an immediate reaction. But I would later learn that, gluten's role in the damage to your digestive tract and that sort of thing. So I had to reel that in. But it was no big deal. I was so happy to just eliminate that. I already was didn't do dairy, only like sheep and goat kind of things. But I did dial up the bone broth. Started making on a more regular basis, or trying to, my own homemade bone broth with just loads of, collagen, minerals, that kind of thing. Um, and a focus on um, a little more like digestive enzymes to help assimilate everything that my body wasn't really breaking down. So those were the big ones in terms of diet. But I already was, eating like the grass-fed, pasture-raised, organic, kind of thing. I think there was initially there a bit where I did eliminate even the goat and sheep cheese. It's been a little bit yet now, so I'm trying to think. I did really, really go easy on my digestion for a little while, just a lot more cooked vegetables, things like that.
Yeah.
Yeah.
Right. Right. For the healing.
Yeah.
Yeah. Definitely. And how long did it take before you started to see some improvement?
As soon as I started the protocol addressing the Epstein-Barr, I want to say in 2 weeks, I really started to feel like we were on the right path. Definitely, we were on the right path. And that was just in terms of my energy level, um, and just thinking a little bit clearer. My spirits were a little bit up, and that was so refreshing. Such a relief
Yeah.
from being in such a dark place. So it did, yeah, in just a couple of weeks. I was very fortunate, but it was still a very long road
Mhm.
from there. But oh, it was like somebody just like threw me a very long, a life vest, but like a very long rope yet. Thank God for the life vest.
You're working your way back to the
Yeah,
shore, but
yeah,
it's
yeah,
taking a while.
yeah.
Yeah. Um, Hawaii metaphor, ocean metaphors here. But
Right. Yeah.
um, yeah, nice. So then like when did you really start to just feel more like yourself? When you say it's kind of been a long, was a long road.
It was, I think I took a bigger step up about 4 months, between 3 and 4 months later was another like, okay, we're really getting somewhere here. We're really getting somewhere. And I started to be able to be more active with my daughter. I started to be able to see like a few more clients without having to sleep for a day or a half a day afterwards. Um, And then there was a point, it was about, I'm trying to recall the timeline exactly. I, I want to say, let's see, it was like June, about a year, maybe about a year, a little over a year later, there was another major. So there was a few phases in between here. And during that year, I don't want to make it sound like I was still trudging along that year. It was like, no, in a couple of weeks, good, a few months, really good. And then something very distinctly started to change about a year, little over a year later. All of a sudden, my brain was back online. Like there was such clarity because I was like a planner. I really like making plans and being organized. I like when my house is in order. I'm not like super neurotic, but I really thrive on organization and planning. And I love, I'm like a once or twice a week to the grocery store with a plan for the week. I hit the farmer's market and I plan what I'm getting where, and even if I show up without a plan, I can formulate a plan really quick. Okay, we're going to do this and this week, and that was gone. That was gone. I mean, I couldn't clean out my car. I couldn't function in the kitchen. I couldn't cook for my family anymore. I would go to the grocery store and sometimes I would just cry. I would just cry because I was like, I don't know what to get. I don't know what I'm going to, if I get that, I have to cook it. And I have no energy to cook it. I mean, and I had to manage my time. Like, if I'm going to go to the grocery store, I'll be lucky to get home and unpack the groceries. I would leave things that weren't that didn't go in the refrigerator for days in the bags, because I couldn't do it. Most certainly could I not go to the grocery store and come home and cook a meal. Like that was out of the question. So like to have my brain come back online and start organizing my life the way that I used to was just fantastic. Yeah.
Yeah, so that was kind of a clue for you, like
Yeah.
you started like maybe planning again, or yeah, like feeling able to do that.
Yeah. Yeah. And it's interesting this, when I started noticing that my brain was coming back online, it was just this like, oh, wow, I can think again, and it wasn't that. I mean, I don't want people to be intimidated by that timeline because there was so much improvement along the way. Um, but I also want people to, I learned patience with healing. You're going to have some big wins sometimes initially, and sometimes some big wins come a little bit later. So, don't get discouraged in your path. Like I was happy before, like the brain kind of really turned back on full throttle. I was happy. I was like, I can do life again. I was in a place that I can do life again. Maybe not quite the same as I was before, but I was just learning to adapt. And then that came along and it was like, oh, okay, yes. So
You're getting there. Yeah,
yeah,
awesome. That is incredible. Yeah, and when you're healing, you need those like success markers,
yes,
even if they're small, like, oh, I can do something that I couldn't do before.
yeah,
I feel like I can, yeah, leave the
yeah,
house today or whatever.
yeah,
Yeah, do
yeah,
something
yeah.
with
It's good to
daughter.
have, it's really good to have little, pieces along the way that keep you going to momentum, right? Have momentum, but also be patient and don't get discouraged when things maybe backtrack a little bit or it's not going as fast as you want. Sometimes the body really just takes time.
Yeah.
Yeah.
Yeah, for sure, for sure. It absolutely takes time and patience. So Rachel, do you feel like you're pretty much back to being able to do all the things that like your full life now.
Yeah.
Yay.
It makes me a little emotional because
Yes, I imagine. Yeah.
was so
Yay.
sick. I was so sick, and now ah, I go to the gym again. I can do yoga. I mean, God, I would try to do yoga. I mean, if I could even bring myself to my mat, it was like my body was like lead, if I could even get there, right? And now it's like I just feel comfortable in my body again. I'm very active with my daughter again. Yeah, it's been amazing. I mean, I have like the anxiety component was so debilitating. The depression was so dark and so deep and hopeless. And now it's like I have no anxiety, none,
Amazing.
none. And before, I think my body had that foundation. It was so beautiful. Tracy had all these other pieces that I think helped along the way, like while I was rebuilding the foundation of my digestion and physical body. There was really neat, things we did with like breath work. And I used to listen to this thing, it's called Holosync, that she had turned me on to, and it would deeply calm my nervous system. I did a lot of yoga nidra, things like that that would kind of keep the demons a little at bay so I could continue working on this, and just really neat tools that helped. But now I feel like uh, it's all coming from here, like the no anxiety, the no depression. It's all coming from very fundamentally from this healthy body.
Yeah.
Yeah.
It's incredible.
Yeah.
Um, and the migraines too? No more migraines?
The migraines are still occasional.
Okay.
They are nothing near
Mhm.
what they were.
Mhm.
Um, and actually, I just started to kind of jump back into that because now they respond. Like if I start to feel it coming on, they're very responsive to, I can just take a little medication
Mhm.
and it's over. Um,
Okay.
and then but it is like the final piece of the puzzle that I've been procrastinating on a little bit because I've been like living life again. So I kind of joke with Tracy. I'm like, oh my gosh, I don't even have time now because I have my life back. It's like it's such
Yeah.
a tiny inconvenience now. It's nothing debilitating. It's nothing like what it was. So it's
Mhm.
kind of gotten pushed a little bit to the back burner, but um, yeah, it's not anything what it was. So we'll get after it. We'll
Yeah, right, right. Sometimes you kind of have to tackle, things one thing
Yeah,
at a
life is
time.
happening now. So I'm like, oh wow, I have to like make time for that.
Yeah, right. Yeah, yeah. Migraines are a tricky one, I think, because the
Yeah.
causes are sort of really vary by person.
Yeah.
But yeah, so beautiful to hear you have your life back and the recovery that you've made, and it really, I know, will inspire hope in others.
Yeah.
Any like advice or any last words you would pass on to others?
I really just in my own experience, part of what held me back, I was kind of in this cycle where I can shake this off, I can shake this off. I mentioned that before, and it kind of prolonged the cycle. But in addition to that, there was a financial worry. The rug was just ripped right out from under us when I got sick. All of our dreams just like floated away as we went further and further into debt without me being able to work. And so part of my procrastination was the worry about finances and investing in, functional medicine. And um, I hit this point that I wish no one else would wait as long as I did. I hit a point where it was like, Rachel, you can't afford not
Yeah.
to do this. I mean, you are just sliding downhill at an increasingly rapid rate. And so looking at what I invested in that to where I am and where my health is now, I wish I would have invested 3 times that amount of money to be where I am now,
Yeah.
and the money has returned,
Mhm.
in,
Yeah.
in a very short period of time. The money has returned. We've recovered from that.
Yeah.
So I just, I wish I would have dove in deeper sooner with Dr. Tracy. I wish I would have, not let that financial component hold me back. Um, and I'm continuously in awe of how functional medicine works and what we have available to us. I never in a million years would have thought of reactivated Epstein-Barr. Um, and I've learned that there's so much of this that's overlooked, uh, and not acknowledged by, or even poo-pooed by Western doctors. So, I just think of all the people out there that are tired and not getting the right answers. They're getting strung along. And I don't mean to diss Western medicine. Western medicine saved my husband's life many times over with he had an aortic dissection, a massive stroke, and lung failure all in a few hours. And thank God for
Mhm.
Western medicine. He's
Yeah.
with us today and functioning and amazing. So I'm careful. I don't want to completely poo-poo it, but I want people to know there's a lot more out there. If anyone tells you that you're incurable or they just don't know the answers, or they'll tell you, oh, it's just hormonal, go home. It's so dismissive. Like, there's so much out there in the world of functional medicine. Take that dive. You won't regret it.
Yeah. Yeah.
Yeah.
Yeah, absolutely. Yeah, it's an investment in getting your life back, really,
Yeah.
uh, to dig deeper. So, well, Rachel, thank you so much. I truly appreciate your time and your willingness to share your story, and I know that this will reach folks who need to hear it.
I hope so. I hope so. Thank you so much for having me. Thank you for listening, and thank you for having this platform. This is really special.
Absolutely. It's an honor and a pleasure to bring these stories like yours forward. So, and I learned something actually from every interview that I do. I
Oh,
usually,
I'm sure. Yeah.
yeah, pick up new information, and yeah, it's fascinating. So,
Yeah.
well, I wish you continued healing and
Thank
all
you.
the good stuff. So,
Yeah. Good things to you too.
thank you.